Nagaland's Directorate of the Health and Family Welfare Principal Director Dr Vizolie Z Suokhrie said that all measures are being taken to ensure that there is no community transmissions of the COVID-19 in the state. The government has made it mandatory of all the returnees to undergo institutional quarantine for 14 days, while taking serious notes of the discriminations and the stigmatizations faced by the health workers and other frontline workers. Dr Suokhrie also called upon to end stigmatization of health workers. In Zan's report. Addressing the media persons at the Directorate of Health and Family Welfare at Kohima on the 9th June, Nagaland Principal Director Dr Vizolie Z Suokhrie stated that misconceptions over the virus led to the panic in the society for which the frontline workers were being discriminated. Taking serious note of the discriminations and stigmatization faced by the health workers and other frontline workers, Dr Vizolie Z Suokhrie called upon to end stigmatization of health workers.
These are all because of misconceptions, without knowing the truth, the reality. I think things are coming out like that. And if we start discriminating health workers, the frontline workers are discriminated, means I think the whole issue of fighting against coronavirus will be over, will not be able to defeat this coronavirus infection.
Dr Suokhrie said it has come to the notice of Health and Family Welfare Department that colonies and villagers were not allowing the frontline workers to return to their respective homes. He cautioned that if they were discriminated, Nagaland would lose the battle against COVID-19. He said the virus would stay for a long period of time and everyone would have to adapt and learn to live with it by avoiding confrontations and taking law into one's hand.
This coronavirus is coming to stay with us maybe for a long period. So how to prevent this coronavirus infection is not threatening each other, not intimidating each other, not accusing each other, not taking the law into our own hands.
He also claimed that 85 to 90% are recovered even without medications and informed that Health and Family Welfare Department of Nagaland had started activating COVID care center because if the current rate continued, hospital beds would have to be reserved for severe cases, while asymptomatic and mild cases would be taken to COVID care center. We are preparing plans and will activate as per the lot of the cases, he informed.
More than 85 to 90% will recover even without medicines. Maybe another 10 to 15,000 may develop into some symptoms, but with simple medicines they'll be all right. With the positive people doesn't have comorbidity, underlying diseases, then the chances of recovery is very high. That is one thing. Secondly, young people, age group between 18 to 45 age group, that recovery rate is very high.
Health and Family Welfare Deputy Director Dr Kikamarent Longkumar admitted that a lot of misconception led to the poor implementation of policies and taking of wrong decisions, while appealing to the returnees to be truthful and assist the frontline workers to help them. He said 5 TruNat Quattro machines have reached the state till now and had been sent to Twingsang, Phek, Wokha, Zunheboto and Dimapur, while 2 TruNat Duo machines procured by the Nagaland's State Disaster Management Authority were given to Paran and Kifire. With Inzanbe Mokovung, Kohima.